Dr. Ben Spencer.
Thank you, Madam Deputy Speaker. As I'm sure you'd expect, as a now non-practising previous consultant psychiatrist, I've got a whole host of declarations I should make in terms of speaking in this debate, and I'd draw reference, probably just for brevity, to my registered members' interest, but also the declarations as part of the work on the Pre-Leg Scrutiny Committee, which I've listened for. I think this is a very important debate today, and I want to focus my comments on two angles. One is in terms of delivery of mental health care and treatment, and secondly on the framework in which that's delivered. And I really want to celebrate today the rebuild of the Abraham Cowley unit, which is going on in my constituency as we speak. It's going to get rid of the awful dormitories that have plagued mental health care and treatment for quite some time. They are gone, and we are going to have a brand new mental health hospital, rebuilt mental health hospital in my constituency. And in fact, tomorrow I'm going to the topping out ceremony on the site to see the progress in that and delivering. And it's going to make a huge difference for delivery of mental health care. I used to work as an inpatient consultant psychiatrist, and when people come into hospital for inpatient psychiatric treatment, quite often it's at some of the most difficult times of their life. I think it's critically important that our mental health estate is fit for purpose, it's a therapeutic environment, and for too long the mental health hospital estate has very much been a second cousin to acute physical health care. I'm really delighted that we are driving this forwards, and in my patch, if people do find themselves in a situation that they need inpatient care and treatment, they're going to get it in a new hospital that's fit for purpose in my constituency. So I just want to celebrate that, and I really thank everybody who's been involved in that in terms of getting it over the line where it is, and all the people who work in that sector, and the people who are currently looking after the patients who would be in the old hospital, but now that's a building site and going through what is of course going to be a bit of a stressful period of transition while waiting for the new hospital to be set up. But the second point I want to talk about is around the draft mental health bill. Now, quite a few years ago now, the former Prime Minister, the Honourable Member, Right Honourable Member for Maidenhead, put forward that we should review the mental health framework, the mental health legal framework of which what we use when we treat people who are unable to consent or don't consent to treatment. And about every 20 years or so, we go through this process. And I think we should be very proud as a country that I would say, have some, we have always been at the forefront in terms of driving forwards legislation and our legal frameworks around how we deal with the situation of people who can't consent to treatment, or the law of best interest capacity and the Mental Health Act. There was a review, the Simon Wesley review. I was fortunate to be one of the panel members on that review, and it was, as I'm sure you can imagine, my pride and delight, having done that in my previous sort of academic life, to be part of the Pre-Leg Scrutiny Committee driving this forwards. And I think, in a way, I'm slightly saddened by this debate today, because I think mental health really, and particularly in terms of how the frameworks we use to treat people who are severely unwell, needs to be above party politics. These are very important things that we're discussing, issues. The most invasive thing we do in medicine is to detain and treat people in hospital, sometimes for quite some substantial time. And I think we need to think about these things very carefully in terms of the right balance between choice, between freedoms and autonomies, and making sure people get the care that they need at the right time, the right framework. I'm glad that the government's done pre-leg scrutiny, and we've worked on a cross-party basis to get this over the line. And I hope that that we'll see the bill very soon in terms of driving it forwards. In my last 40 seconds, I just want to mention something else, and this we said this in our report about the focus on psychosis. The government amendment, one line I'd just like to draw the House's attention to is that it mentions, particularly in terms of treatment of psychosis. And I know, in fact, psychosis often gets missed out in these debates and when people talk about mental health. Psychosis is far and away one of the most disabling mental disorders, far and away the most costly, certainly in terms of impactful, because it can affect people when they're quite young. Of course.
It's incredibly helpful to have his really
detailed experience here. Why does he think it gets missed out?
Spencer?
Thank you. I thank you so much for the intervention. Very simply because of advocacy. So the areas that we see debated in this House, the conditions that tend to get debated tend to be mental health conditions in which there's people who can advocate. Yeah. So we have, we talk a lot about dementia, so we have people who are the children of people suffering with dementia who tend to advocate. With CAMS, child and adolescent, with parents who advocate. With common mental disorder, people very much are able to advocate for themselves, but psychosis tends to be, well, I'm not going to make a sort of broad generalisation, but psychosis can be quite disabling. It can be very isolating, and it can limit people's own ability to advocate for themselves. And I know from my own research, back in the day, it's very well known in terms of psychosis that it can also break down family relations. And people can end up alienate. Again, I'm very nervous to draw broad brush generalisations. For the most part, people get better and do very well, but in some cases it can be very disabling, and that advocacy is an issue. And on that point, I shall stop.